Okay, so this is just a quick review over disorders and treatment. A couple things that I just want to make sure I touch base on, and then one point that I just want to clarify. So on the AP exam, they love to put anxiety and schizophrenia on the AP exam, both multiple choice questions, but also it tends to appear a lot in the FRQs. So I just want to make sure I touch base on that again and just kind of go over things a little bit more in depth and in detail, more so than what they did in the presentations or what I had required them to do in presentations, just to ensure that everybody has everything that they need. So first, and this one was covered in the presentations, are the different types of anxiety disorders. So you can have generalized, panic, phobia, OCD, and post-traumatic stress disorders. Those are all considered anxiety disorders. I want to go over the difference between generalized and panic and phobia, just so that if they come across in a question, you can identify which is what. Generalized is when you have continuous, or it's continually in a state of autonomic nervous system arousal. So remember, in your autonomic nervous system, it's things that happen automatically, and that's going to divide into two systems, the parasympathetic and the sympathetic. So you have to think about that fight or flight response. So, you know, pupils are dilating, heart rate is increasing, digestion may stop. Those are things that are going to happen when you're anxious. And so generalized anxiety disorder, one of those or more than one of those symptoms is occurring continuously. So maybe not all day, every day, but frequently enough where you would consider it continuous. Versus a panic disorder, where it's going to, again, be that autonomic nervous system trigger, but it's only going to last for a few minutes and tends to be more intense than the generalized anxiety. So one of the best descriptions is you feel like you're having a heart attack, even though you're not. And then a phobia is when you get those same feelings or that same sensation, but because of something specific, whether that be, you know, agoraphobia, fear of social and public places, right? Or, you know, arachnophobia, fear of spiders. There's a couple thoughts onto why we have anxiety or what causes anxiety disorders. The first is a learning perspective, and this is that fear or anxiety is learned. The idea that you are conditioned to have anxiety. In order for you to have fear conditioning, in order for that to be the cause of anxiety, two things need to happen. You need to have generalization and you need to have reinforcement. So what do I mean by that? Well, with generalization, it means that something happened that you were fearful of, and you generalized that one specific instance to a more general array of situations. I was driving in a car, I got in a car accident. Now, instead of just being afraid of that specific intersection or that specific car, now it's cars in general, or being on the road in general, or driving to, you know, certain places in the evenings or early in the mornings. So it's now has expanded beyond that one specific instance into a generalized fear. The second thing that has to happen, though, is not just that fear, but then there's some sort of reinforcement. So if you do something to relieve the anxiety, and that anxiety is relieved, then that can almost reinforce the more anxiety-producing activities. So if you think about like OCD, if you are obsessing over, you know, turning on the light switch, and then you turn the light switch on 10 times, and then that anxiety goes away, you've just reinforced that behavior. The second type of learning perspective can be observational learning, and this is where you learn from your parents. So your parents are fearful or afraid of something, and then as a child you learned that same development. Biological perspective is the second type of perspective that takes a look at anxiety disorders. There is an idea that we are naturally born with some innate fears in order for us to survive. So the idea that, yes, we are afraid of heights. Not everyone is fearful of heights, I get that. But the fact that the reason why people are afraid of heights is because it's survival, right? Like heights means that you could die. Same thing even with the nighttime. We can't see very well at night. Predators are at night. So therefore we have this innate fear of nighttime. Then there's a genetic perspective, or genetic aspect, and that is that you are genetically predisposed. What I want to be clear about this is that that does not mean that you are born with it. It just means that based off of your genetic makeup, that you have a likely chance that you could potentially develop an anxiety disorder. That being said, you still typically need a traumatic event in order to trigger that anxiety disorder. We do tend to see anxiety, as well as many other psychological disorders, run in families, meaning that there's a higher likelihood within a specific family than between you and someone you're not related to. Again, doesn't mean that you'll have an anxiety disorder. Just means that there's a genetic predisposition. If you pair that genetic predisposition with a traumatic event, there is a chance that you could develop anxiety disorder, more so than someone who does not have a genetic predisposition for it. Third, OCD. When they've done studies on brains of OCD patients, they did find that when an OCD patient is partaking in their compulsion, so the obsession is the thing that they stress and worry about or have anxiety about, compulsion is the action they do. So when they're when they're doing that action, you actually see elevated brain activity in what we call the anterior cingulate cortex, which is essentially part of the frontal lobe. The second topic that I want to go over more in depth is schizophrenia, because with schizophrenia, again, tends to appear on AP exam in multiple choice and free response questions. The word schizophrenia means split mind, and we don't mean two personalities here. We mean that your mind is splitting from reality, that you are somehow losing track of what's real and what's not. These are the 5 major types of schizophrenia. They did get covered in the presentations, but here they are just to go over. Oh, we'll see if I can get through this all. Okay. It does affect people from all cultures equally. So 1 in 100 typically suffer from schizophrenia. There are 2 types of symptoms. Again, these were covered in your presentations. One thing that I want to hit on is acute versus chronic. Acute means that you develop schizophrenic symptoms very quickly, typically after a traumatic event. What we find with this is that it is more likely to recover from it, versus chronic, where you develop symptoms slowly, and we start to see a slow withdrawal from society or reality, and that is much more difficult to recover from. These are, if you want to call them, the causes or the hypothesis or the thoughts behind why people suffer from schizophrenia. The first is what we call the dopamine hypothesis, meaning that there's too much dopamine or there's an excess of dopamine receptors in the brain. And what we see is that these create what we call positive symptoms. We do see that cocaine can intensify these symptoms. One thing to note is that people who do a lot of cocaine can suffer from schizophrenic-like symptoms, positive schizophrenic-like symptoms. Doesn't mean they have schizophrenia, but we do see them suffering from similar symptoms. Now, on the flip side, they see that glutamate or a lack of glutamate activity can produce or cause the negative symptoms of schizophrenia. A second theory is brain activity. What we find in schizophrenic patients is that, unfortunately, it impacts so many different regions of the brain, which is why it's so hard to identify and treat. So we do see low activity in the frontal lobe, but we see increased activity in the thalamus, especially when people are hallucinating. We tend to see smaller hypothalamuses in general, which might be why there's so many delusions and hallucinations and withdrawal from society, is because they have a hard time transmitting information. In addition, there's also been findings of enlarged fluid-filled areas in cerebral tissue, and not surprisingly, people with larger fluid-filled areas or more fluid-filled areas tend to have more severe cases of schizophrenia. Another interesting study is maternal viruses during pregnancy, and what they find is that there is an increased link or an increased risk of individuals being with schizophrenia having mothers who either in the first half of the pregnancy suffered from the flu influenza or grew up in an area or region where there was a flu epidemic, or where, I'm sorry, when the mother was pregnant, was in a region where there was a flu epidemic. And we see that there, again, is just an increased risk. Again, 98% of mothers that get pregnant and suffer from the flu will not have a child with schizophrenia. We do, however, see that there is statistical significance between mothers who end up with influenza in the first half of their pregnancy and increased risk of schizophrenia. And again, just like with anxiety, there is a genetic factor. We see a genetic link. We tend to see it more common in families. Again, does not mean that you're going to have it. Just means that there is a genetic predisposition for it. What we do know is that if one identical twin has it, there's a 6 in 10 chance that the other will as well. So if you think about it, typically you have a 1 in 100 chance of having schizophrenia, but if you're a part of an identical twin and your identical twin has it, all of a sudden it goes from 1 in 100 to 6 out of 10. So that shows you, again, there's a very high statistical significance behind it running in families. And lastly, I just wanted to retouch insight therapy. We talked about insight therapy when we talked about treatments, and I incorrectly categorized it as a humanistic therapy, which it is, but it is not just a humanistic therapy. And I wanted to go back and clarify that and then be really specific on how you can identify if it's humanistic versus if it's a psychodynamic therapy. So the whole goal behind insight therapy is that the goal is to reduce inner conflicts that are impeding natural development growth. And they do this by providing clients with new insights. So you might have some sort of inner conflict, and because of that inner conflict, it's preventing you from having what you would consider a well-developed or normal life. So maybe it's causing problems with relationships, maybe it's causing problems with work, and so therefore you seek out therapy. Now, for humanistics are going to focus on the present. That's very, very important to notice. So they're going to focus on, well, what is going on right now and how can we help you in the future? So how can we do, moving forward, what can we do to make things better? They focus on things that you're conscious or consciously aware of. They also want you to take immediate responsibility for your own feelings and actions. And they do this purely to promote growth. Remember, humanistic hippies, you're reaching self-actualization. Your whole goal is growth. Now, psychodynamic therapists can also use insight therapy. But the difference here is two things. First off, they focus on childhood origins. So they talk about childhood origins, so things that happened to you when you were smaller, and how is that impacting you. Another one that I did not add here and you need to know is, just like humanistics focus on the present and future, psychodynamics is going to focus on the past. What happened in your past that might be causing these inner conflicts? And they're trying to uncover hidden determinants as to what's causing this. So again, that hidden determinants, that unconscious thought process as to what is causing this inner conflict. Whereas humanists are going to focus on your conscious. What are you currently aware of at this point in time? So I just wanted to make sure that I go back over those two. Now, make sure you go through your review sheet and all parts of it. Make sure you know all the people on there. Make sure you know all the things and the ideas and the disorders and the treatments, because you're going to need to know all of that for the exam.